This is week 7, and next week you'll have the ATI proctored fundamentals, and then you retake in week 10. Both weeks you're required to take it, and what you'll get is the points for the exam with the highest score. And we're going to talk about infection in Module 7. Objectives, you should be able to describe the physiological process involved in the maintenance and restoration of health and wellness. Describe the processes involved in primary, secondary, and tertiary defenses. Demonstrate the use of standard and sterile precautions to prevent infection. And then explain why multiple drug-resistant pathogens aid in the spread of infections. And then listed below are terms that you should know. And then talking about interrelated concepts. Infection, your nutrition affects it, tissue integrity, immunity, stress can affect infection, and then inflammation. Inflammation is a nonspecific response from the immune system in response to either a tissue injury, an infection, or an allergy. Inflammation is an expected response to an injury and can cause a lot of pain and discomfort. As nurses, some of our goals are to help support the patient while the body attempts to repair itself. Injury causing inflammation examples are mechanical injury, thermal, electrical. Um, The function of the inflammatory response, what it wants to do is restitution of normal functioning of cells after injury, so bring the cells back to hemostasis. Fibrous repair when restitution of functioning cells is impossible. Some common characteristics to inflammation is your redness, swelling, heat, and pain. The outcome ends up being loss of function in the injured area. If these signs are directly related to the physiological events that during the inflammation process, the redness and heat are usually caused by increased blood flow to the injured area, which is trying to help heal it. The swelling is because of the leaking of plasma cells and leukocytes to that area. And then the pain is a result of the increased fluid and production of chemicals causing injury to the nerves, which then causes pain. The steps in acute inflammatory response, the tissue injury and the release of chemical mediators, then vasodilation, increased blood flow to that area. Then there's swelling, retraction of activated endothelial cells. You have increased vascular permeability and leakage of small plasma proteins, and then there's a walling off. Then you have a movement of the immune response cells to that site of injury, exudate forms. Then you have movement of glucose and oxygen to the site needing repair. And then there's a release of chemical repair factors from the activated endothelial cells. Is exudate a normal response in the inflammatory process? Yes, it is. Can it also be a sign of infection? Yes. So, as nurses, it's our job to assess all wounds for size, shape, depth, approximation, redness, swelling, and drainage. So, exudate can be normal, but it can also be a sign of infection. So, that's where our critical thinking comes in. Consequences of excessive or ineffective inflammatory response. You can have local tissue damage from compression, development of chronic inflammation, or systemic pathology. So you could have atherosclerosis, chronic renal disease, neurological disorders. Risk factors, so populations at greatest risk. Inflammation affects all individuals, doesn't make a difference of age, gender, race, or socioeconomic status. The population at risk for severe or ineffective inflammatory response are you're very young, you're very old, and you're uninsured. So those that are in poverty. Moving to infection. Inflammation is an immunological defense against tissue injury, infection, or allergy. An infection is the invasion and multiplication of microorganisms in body tissues, which may be unapparent or the result of local cellular injury, which could be caused by competitive metabolism, toxins, intracellular replication, or antigen antibody response. Then we're going to talk about the type of pathogen. So you have parasitic or protozoal infections. You can have fungal, viral, or bacterial infections, and this is the type of pathogens. And then we have the classes of infections. Primary, that's your initial infection. Secondary occurs as a complication of or secondary to a primary. So an example would be herpes simplex versus type 2 cold sores, or bacterial infection of a cold sore. So a lot of times people will get infections and then they'll also get cold sores, so that becomes the secondary. We have exogenous and endogenous. So the exo comes from someone or someplace else, and the endo is a reactivation of infectious organism within which is within the body. So exogenous could be like salmonella, common cold, where endo could be tuberculosis or shingles. Your infections, the duration, it could be active, chronic, or latent. Rapid onset of duration, short duration, it's kind of like the common cold. You could have a slow development, long duration, which would be like your osteomyelitis. And then you have the diseases present, but without symptoms. So you're talking your HIV and AIDS. Your susceptible host, very young, very old, you're immunocompromised. Other risk factors might be chronic illness, malnutrition, anemia, stress. And then we talk about reservoirs, nutrients, moisture, temperature, oxygen, pH, electrolytes, light. So the reservoir, this is the source of infection. It's the place where the pathogens survive and multiply, and they like warm, dark, moist areas. So that's why you need to be watching um, these different elements. We have a portal of exit. This is like your body fluids, so it's your blood, saliva, tears, feces, urine, breast milk, vomit, semen, mucus, coughing. Could be an exit is your skin damage, so puncture sites, drains, cuts, abrasions. It could be pus. A reservoir is only a potential source of infection. So in order for an infection to spread, it needs to exit the reservoir. So you have to have a reservoir. Mode of transmission, you have direct contact, you have indirect, you have droplet, airborne, or vector. So that could be touching, kissing, infected object. When pathogen travel and it's inhaled, you have airborne travel through heating vents. And then vector is something, the carrier to a host. So it could be like a bite. And then you have the portal of entry. This is our normal body openings, our nares, our mouth, the vagina. Abnormal body openings would be like lacerations, abrasions, surgical incisions, IV site, and then you have your vector bites. Infectious process, immune responses to bacterial invasion. So B lymphocytes are activated, they result in the production of antibodies. T lymphocytes are activated and they result in phagocytosis. Complement system is activated to enhance overall response. The bacteria release endotoxins or exotoxins, which damage the cells of the host, and then they initiate an inflammatory response. Risk factors for infection and populations at the greatest risk. Infections potentially affect all individuals, doesn't make a difference your age, gender, race. Those that are at the greatest risk is the very young, the poor, uninsured, or residents of geographic areas where the infection is prevalent. And we need to make sure that we're teaching our patients, even if they don't feel sick, it doesn't mean they are not at risk for an infectious disease. Factors that increase infection risk: developmental stage, breaks in the skin, illness, injury, chronic disease, smoking, substance abuse, multiple sex partners, medications that inhibit or decrease the immune response, and it could be even just nursing or medical procedures. Factors that support host defenses: getting enough of your the adequate nutrition, making sure that you are cleaning yourself, have a balanced hygiene, rest, exercise, reducing stress, immunization, to manufacture cells of the immune system sufficient to decrease skin bacterial count and not overzealous, so it causes skin cracking. So when they're talking about the hygiene, just make sure that we're getting the body what we need, but not enough that you're overdoing it, causing skin cracking, because then all of a sudden now you have done a portal of entry. Then we have septic shock, which is a strong inflammatory response to toxins secreted by bacteria. It contributes to organ damage. It is a medical emergency. Signs and symptoms you're going to see are cool and pale arm and legs. They may have a very high temp, but they may also have a low temp. They usually have low blood pressure and tachycardia, oliguria, restlessness, agitation, confusion, or lethargy. A lot of times you'll see a skin rash. Common diagnostic tests. You'll see them doing laboratory tests. CBC with white blood count differential. You might see a culture and sensitivity, C-reactive protein, erythrocyte, lactic acid, serologic tests to detect specific antibodies or viruses. They may have radiographic studies like X-rays, MRI, a CAT scan, a PET scan. Clinical management screening, the most common infection screening. How do you determine who is in a high-risk group? Sexually transmitted infection is a high-risk group, and tuberculosis screening in high-risk groups. So you want to be looking at those people. So your sexually transmitted or your infections, so your HIVs, your STDs, different things like that, the tuberculosis, they're going to be your high risk group that you're going to make sure that you're screening. Clinical management, you want to do antimicrobial therapy, rest and care comfort measures, nutritional support, fluids. You want to make sure that you're disinfecting the environment that you're in. Then we have the different types of antibiotic agents. Penicillin, you have your cephalosporins, you have fluoroquinolones, tetracyclines, microlides, aminoglycosides. You'll have your antiviral, antifungal, antiprotozoal. And then we talked about the different diagnostic tests. We talked about the CBCs, the white blood count with differentials. So you're looking at your eosinophils, neutrophils, basophils, monocytes, lymphocytes, CRP, ESR, and then again your radiographic. You have your clinical management, so prevention. You want to seek to prevent the onset of the specific diseases via risk reduction. So you want to alter behaviors or exposures that can lead to the disease or enhance resistance to the effects of exposure to a disease agent. So that could be examples are quitting smoking, making sure you're getting vaccinated. You want to reduce risk for injury and infection, maintain good hygiene. You want to properly use safety equipment. You want to properly store and prepare your food. Then you have secondary prevention. That includes procedures that detect and treat preclinical pathological changes and thereby control disease progression. Tertiary, you seek to soften the impact caused by the disease on the patient's function, longevity, and quality of life. Since the disease has once a disease has developed and has been treated in its acute clinical phase. So you want to get routine blood sugar testing, mammographies, proper wound care, proper nutrition. When you have inflammation, you want to use ice. So you want to do RICE, rest, ice, compression, elevation. Um, General discussion questions. What's the best method for applying ice? It should be applied 15 to 20 minutes at a time every 2 to 3 hours over a couple days. Um, what should the nurse monitor? Well, we want to decrease edema or swelling in the leg, and that's why we want to make sure we elevate the leg higher than the heart because of the flow of our blood. Um, Icing is most helpful after a sprain, strain, or trauma. It helps minimize swelling, and it's most beneficial for the first 24 to 48 hours after the injury. Here's different exemplars of inflammation that you should know. Here's nursing diagnoses related to infection. Here's clinical management. You guys want to make sure that you can provide at least one specific example of each drug category. So the steroids, what's the role in the treatment, and what type of drug would you be looking for that would be considered a steroid? You want to review what is dysfunctional wound healing, what are common wounds, what is one wound management, so nutrition, cleaning wounds, etc. Why do we get a culture? Inflammation process, what is happening, what medications help. The biggest thing that we need to know is nutrition is vital for wound healing, and they really should be having a diet that's high in protein. Then we're talking about the transmission-based precautions. So you have your contact precaution. It's spread by direct contact. Could be from a draining wound, could be secretions, could be supplies that have not been sterilized. If they have these precautions, they might put them in a private room. Clean gown and glove, dispose contaminated items in the room, and then you want to double bag linen and mark it that it is hazardous. Then we have droplet precautions. Pathogen is spread via moist droplets, so coughing, sneezing, touching contaminated objects. Precautions include, it's the same as those as for contact, but you're probably going to add an addition of a mask and eye protection when you're within 3 feet of the client. And then we have airborne precautions. Pathogen is spread via air currents, so it could be via the ventilation systems, shaking the sheets, sweeping. Precautions are the same as contact with the addition of a special room, special mask, and a mask for patient when transported. Protective isolation, you have your protective equipment. We want to protect the client from the organisms. It's used in special situations with immunocompromised client population. You may be in a room with special ventilation and air filters, no carpeting, daily wet dusting. You want to avoid standing water in the room. A nurse that is being assigned to this patient will not be also seeing patients that also have active infections, and then you're using the standard and transmission-based precautions plus a mask and other PPE. Skin integrity and wound healing. Factors that affect skin integrity: your age, mobility, status, nutrition, hydration, sensation level, impaired circulation, medications, moisture, fever, and infection. We talked about as the elderly get older, their skin is less elastic, it's drier, more prone to injuries. mobility status, increased pressure, shearing, and friction can lead to breakdown. Poor nutrition, they have less regeneration, and then dehydration. You usually have poor turgor. Sensation level, you have diminished sensation that leads to increased risk for pressure and breakdown. And you'll see this a lot in your diabetic patients, especially when they have neuropathy. Impaired circulation, they could have negatively affects the tissue metabolism, your medication. You're having your side effects of itching and rash. Wound classifications, you have open, closed, acute, chronic, clean, contaminated, infected, superficial, partial, or full thickness, or penetrating. Acute means that it's just short duration. It does not have any complications. Where chronic, you have complications, and the different types of arterial, venous, diabetic, and pressure. So 4 types: arterial, venous, diabetic, and pressure. We also have different types of wound drainage. You have your serous exudate, which is more of your straw colored. Sanguinous is bloody. Serous sanguinous is the mixture of blood and straw colored. And then you have purulent, which is your yellow and it contains pus. Exudient is usually fluid that oozes as a result of inflammation. And we had talked about that in the inflammation. Exudient can be good, it could be bad. Serous, usually you see in clean wounds. Sanguinous, you usually see in deep wounds or wounds that are in highly vascular areas. Serous sanguinous are usually new wounds, where your purulent is usually an infected wound, and that's why we're seeing the pus.